Do you train combat sports? Have you ever been injured? Dr. Megan Jimenez is an Army orthopedic sports surgeon and Jiu Jitsu black belt. This is Doctor Jiu Jitsu, your go-to podcast for combat sports, military performance, injury prevention, and treatment. New episodes drop the first Friday of each month.
Hi, I'm Dr. Jimenez. I am an orthopedic surgeon and black belt in Jiu Jitsu. I'm sitting here with my good friend, Mike Piekarski. He is also a black belt. He's been a black belt since 2018 and a physical therapist since 2015. You guys might know him as Dr. Kickass on Instagram. It's an honor to be here with him. We've been talking and chatting and doing research for 2 years, maybe 3 years?
Yeah, it's been a while.
And we're finally meeting this time for a course that you did yesterday.
Yeah.
If you want to do a little plug on that real quick.
Sure. So, I did my first Treating the Jiu-Jitsu athlete course, which was just a full day course where, I get a whole bunch of physical therapists, athletic trainers to come down, and we talked about how the rehab process might be different for a jiu-jitsu athlete versus like a traditional field athlete or just general population. And for me, it was super cool having an orthopedic surgeon there because, as a PT, it's kind of like I get to learn so much from orthopedic surgeons in general. So to kind of like hear something on the other side, it would just, it made the course for me just a little bit, it just added that little depth. And I could definitely tell that there were a lot of the people who attended appreciated your insights.
Well, yeah, and it was awesome because a lot of orthopedic surgeons, I think, aren't super keen on what goes into physical therapy.
Sure.
And it's not by our fault. It's we're not trained in it. We're not taught it. We do a surgery. It's on to the next surgery.
Correct.
All right, go see a PT.
Yeah.
But not all PT is equal.
Correct.
And I think your flair for it, treating jiu-jitsu athletes, which is where I'm going as well in orthopedics, and treating jiu-jitsu athletes is very different than the regular athlete. Mm-hmm. What are the big differences that you see when you treat, because you treat in clinics still, but you also have your online jiu-jitsu focus, which is probably your bigger focus.
Yep.
What do you see as the big difference between other athletes and jiu-jitsu athletes when you're treating?
Well, I would say a big thing with certain things is you look at the demand of the sport. So a field athlete, they need to run, they need to jump, they need to cut. And that's not necessarily the focus of jiu-jitsu. Like, obviously, these are things that you can do. You still want to develop their athleticism, but it doesn't have to be the major focus. One of the big things that I look at is, we look at what I call my movement milestones, and these are movements or positions that are somewhat unique to jiu-jitsu. And from there, you can kind of boil down what does the injured joint need to be able to do. And then from there, you make sure that the joint can do everything that it's supposed to do, and then you can then build in the sport-specific movement like kneeling, framing, posting, etc. And then we kind of build from there. So in my opinion, that is where, sport-specific PT or rehab should be, is, understanding the demand of the sport. And those are some of the things that I typically see.
Is your rehab pretty similar in the early stages after a surgery?
Yeah. And
when do you switch a focus to, hey, jiu-jitsu is where we need to return to? Around what, I guess, time frame? Or, you do an ACL surgery. At what point are you switching from that more athlete-focused early recovery to sport-specific?
So I would say the way that I look at it is acute, subacute phase is pretty similar. It's when we get to that strength and conditioning, can start thinking about return to sport phase where it gets a little bit different. So specifically for ACL, it would be between month 4 or 5. So a lot of times, because I do work with people online for return to coaching, so it's kind of like when their insurance ends, which usually is around month 4 or 5, but we know that return to sport is month 9. That's usually kind of when I take over that role, so I can do that last 20% to ensure that the athlete's actually ready to get back to sport and they don't re-tear their ACL.
So if an athlete tears their ACL, for example, heel hook, right? How I tore mine. How many people tear ACLs? When are you putting them back into that position to start mentally getting ready for that position again and stressing the leg for that position again?
So I do, I remember, at the course I talking about doing like long range rotational isometrics, and I think where I'm going to go with my course is I'm going to take one of those lectures, I'm going to put it online, and then I'm going to spend like a more in-person time where I get someone on the mat and I do it. But literally what I would be doing is like I would get someone on the mat and I'd be like, or the table, so they're not even on them, and I'm doing isometrics, so it'll look like I'm heel hooking somebody, but I'm just doing low level isometrics, so they're resisting, they're doing that yielding isometric that I discussed. I could be doing that month 2, 3, but because it's all low, so I'm doing low level isometrics, so they're getting exposed to rotational stress fairly early on. If I am working with an athlete at that month 5 mark where they'd already done PT. Most PTs aren't doing those rotational stresses, so it might be month 5. But for me, like I could do it fairly early. For something like meniscus repair, where you want to specifically, if it's like a complex tear, you want to avoid those rotational movements, I might wait until month 4. But I think meniscus repair is probably like a more conservative in that sense. So like literally it would look like I'm heel hooking someone on the table.
Yeah,
but,
and just a low velocity or very low amount of stress. Correct. Do you think that's more for the mind or for the body?
I do it more for the body, but there is the mind component as well, because a lot of times, I mean, you know what it's like, you know, when you were going through ACL rehab, where like you're like, okay, now I'm in a heel hook, is this person going to try to break my leg, you know? So now, like one of the things that I like doing from a psychological confidence standpoint is like, you know, we do all the, you know, I kind of ran you through the course where we have my movement milestones, and then, you know, the graded exposure to sport. So they're going through jiu-jitsu, but they're not getting the leg attacked. And then at some point, I would want to get their leg attacked in a controlled way. So when I do that approach on the table, I feel like that helps them, because like, oh yeah, like I've been heel hooked by my PT. Not really heel hooked, you know what I mean?
I've been put in these positions in a safe manner.
Yes, yeah.
And even when I was returning back after the clear from my doctor, which I did behave and wait for, at that point I went back and I went with small people, my size, and I just said, don't go after my heel, just put me in a Achilles grip. Put me in outside actually where I got injured, and just let me work, but don't try to put anything on, don't force anything, let me just figure it out and get my mind, because I get put in that position and my heart rate would go through the roof.
Exactly.
Because I was just nervous. I had seen it so many times on tape, my ACL tearing, right? And so
you got a tape of it?
Oh yeah.
Oh no.
Yeah. So then you can watch it and watch it and watch it, because I didn't know what happened when it happened.
Yeah.
So that was the interesting piece. I kept going. And then afterwards, I was like, okay, let's do another match. So it wasn't until I watched the. I was actually getting a tattoo the next day, and I was showing my tattoo artist. He's like, wow, it's a miracle you didn't tear anything, and I was like, damn. I definitely did. You know, I didn't even realize it was a little swollen. I wasn't unstable, and so different ways, different ACL patterns, and how you experience it. Okay, so kind of going back, let's go to your origin story a little bit. Black belt, physical therapist. We joke around because yesterday we rolled for the first time finally. We're both going after each other's legs.
I know.
But in a very controlled way. Right? I didn't feel in danger. We were safe. You grip something, you let go, and we move along. And that's how I wish more people could train. But do you think, or how does being a physical therapist and a black belt tie into each other? And then how did your brand get started?
So I'll start with my origin, and then I'll kind of go from there. So I had started jiu-jitsu 2006. I was in college. Actually, I think what happened was I was in where I went to college, there was a club, and it was like, I'm surprised we didn't all get destroyed, because there was the guy running the club was a white belt. So like, it was like the Wild West. Like we were doing heel hooks on each other day one, you know, we had no idea that they were bad. And then I found a guy local when I'd be on break. So that's when I really so my first coach at the time was a purple belt. So, which is, you know, it's kind of interesting now that people start with black belts and they don't realize, like back in the day, what it's like you don't really have access to black belts.
We didn't have access to tape. We didn't have access to Instagram, social media really. And people would black out their windows, right? Because it was like, our gym gets this and your gym. There wasn't this like interaction cross-training either.
So I started jiu-jitsu, and then I'm like, this is cool. And then my coach was fighting, and then one time he approached me. He's like, "Are you interested in fighting?" And I'm like a nerdy, unathletic guy. I was like, I can't fight. And then I started preparing for it because I was helping him, and I started having fights. And then, I had my pro fight, and I got my nose broken. And I was already thinking this way at the time. Because I'd been in like pro MMA gyms where I could see those people. There was a few guys that I used to train with, like they were in the UFC, but they were like the best of the best. They were natural athletes and they were super dedicated. And then you'd see those people who weren't quite at that level, and they were kind of in these local shows making peanuts for money, and they're like hoping to get that one win so they get to the UFC. And like I realized like I don't have the athleticism to be a UFC fighter. As much as like I could train as much as I want, but the athleticism, it just wasn't there. So I was like, okay, well, I need a more realistic long-term career path. Originally, I was thinking about being a personal trainer, and then I was thinking about being a physical therapy assistant, and then I realized I don't like listening to rules, so I was like, well, I'll just be a PT so I could do my own thing. And then it wasn't until like I graduated that I realized that I could kind of merge the two, because I wasn't thinking doing PT for jiu-jitsu, because at that time, like, jiu-jitsu was so small, there's no money. And then, I'd be in the clinic and I'd be training with people, and then some of my training partners would come see me, like, I want to work with you because at the time I was a brown belt and I keep my black belt. They're like, I want to work with you because you understand jiu-jitsu. And I'm like, oh yeah, I guess I do. But then, this is why I made the course, is even though I did understand jiu-jitsu, it wasn't as systematized as like my course was. It was just more haphazard. So then what I did is I kind of took my rehab process, I put it on paper, and then I kind of allowed myself to streamline the process so then I could teach others kind of what I do.
Yeah, and I love your courses online too. I go through them, and even when my partners at work, other orthopedic surgeons, they're like, hey, I've got this guy that likes jiu-jitsu. I just did this ankle reconstruction. What the hell do I do? Because nobody knows the terms. They don't know how to tell them to go back. And so I always go to your stuff and I'm like, all right, what would Mike would Mike recommend at this stage? And then we try to help the local physical therapists, because most people don't know what a del hiva is. They don't know what these positions are, and they don't know how the injuries occurred when you tell them the lingo. So people do come to us because we understand the lingo.
Yeah, and one of the things too for my jiu-jitsu rehab course, like, I reach out to you and a few other surgeons because I didn't want to say, hey, you can get back to jiu-jitsu at this time, and a surgeon looks at it and like, what are you and then they hate me as the, so I kind of wanted to see like, what would a surgeon be okay with? Because I mean, you doing jiu-jitsu, you're obviously probably less conservative than but there's a lot of surgeons out there that are like very, very conservative. So, I kind of wanted a good balance, getting a good idea. So like, I didn't get someone on the mat too slow as well, but I also didn't want to make it too fast where they're going to be re-injured.
Yeah, and that's why I appreciate the collaboration.
Yeah.
When we work together, getting those athletes back, it's so much more helpful. We talked about that too yesterday with a lot of the PTs, because it's tough to find the PTs when there's hundreds of PTs, and then you're just sending your patient out with a little protocol. It's hard.
Yeah.
Okay, so what is the biggest mistake you see jiu-jitsu athletes make when they get injured?
I think it's just that they ignore the injury. They just think, oh, my elbow popped, it's fine, it'll be back the way it was. And, that's not always the case, especially as we get older. We don't heal as well. And then, these minor injuries start becoming these like chronic disabilities. And, this is why you look at all these black belts and they just, they only can play a very limited game because they've so many injuries that like they can't do the game they did when they're in the 20s and 30s.
Yeah. And ignoring it early. So, I mean, you probably get these texts a lot. I get these texts all the time. Hey, my elbow popped again. I was like, okay, what did you do the last time it popped? I just put a sleeve on it and went and kept going. It's like, okay, it keeps popping, so when are we going to do something different, right? Definition of insanity, right? We keep doing the same thing. How do you talk to these athletes? Because I feel like I can never get through, and sometimes I am that athlete, right?
Yeah, for sure.
Like, oh, my neck is a little sore, but I'm not stopping. And the game modification, I think, is a big deal. And we can go into that too. But how do you talk to these athletes and help them make better decisions for longevity, right? For them in 10 years, for them in 20 years.
I mean, so, there's some good, and I'm very guilty of this too. Like if there's a minor injury, like I'm still training, but it's kind of, and this is kind of difficult. What's a mild injury and what's something where you actually have to do something about it? So, if you have like a tweak and like within a few days you're back to normal, like it might not be something you can't be on on the mat. Or, it's not a bad idea to just go straight to activity modification. Someone tweaks your neck, maybe you're going to just do more focused on gi because there's going to be less of those guillotines, front headlocks. Not that they're not there, I still do them in the gi, but you have other options, and gi chokes tend to be cleaner and they're nicer on the neck. So that's a super easy one. So I'll use those objective testings that I ran someone through. Like when we look at ACL reconstruction, or like whether someone needs a reconstruction or they can go non-operative, like being a coper. A lot of those tests that I do to clear someone, I could just clear to see if they're a coper. Like, to identify a coper is, I think like there's like those one criteria is like, can you hop on one foot? Before we even see if if they can do that and their knee doesn't buckle, like they could potentially be a coper.
Yeah, can you explain that coper a little bit more, what that means?
So a coper is someone, and I don't know if there's any science on why someone's a coper, but there are some people that have no ACL and they don't need surgery, they can do sport, they have no instability. I would be fascinated to know why. Like is it based on with the injury? Does it just like the ACL scar in a way that you have that stability? Is it a neuromuscular control issue?
That's what I think it is. More neuromuscular, and Age is a big one,
Sure.
right? Because
Sure.
the older patients, I tend to offer non-operative more for.
Sure.
But people are under the misconception that they have to get an ACL surgery.
Sure.
And I get soldiers all the time that come into me and they're like, my ACL is torn, I have to get a surgery.
Yeah.
Well, not necessarily. Like, let's talk about that.
Sure.
And so the COPER thing, there is a COPER classification,
Yep.
and there's criteria that people meet to
Correct.
see if they will be a COPER.
Yeah.
The problem with jiu-jitsu is, and probably a lot of sports, I think I see it more in jiu-jitsu,
Yeah.
is lack of insurance,
Sure.
maybe lack of trust in the medical field,
Yeah.
but they will tear their ACL, hear a pop, not know,
Yeah.
just keep going.
Yeah.
Because especially with leg locks,
Yeah,
not
yeah.
even getting to a heel hook, just the
Yeah.
entanglements and the rolls,
Sure.
there's little pops that happen.
Of course, yeah.
And could be ACLs,
Sure,
but people
yeah.
keep going.
Yeah.
They don't even know.
Yeah.
And then sometimes I'll go visit a gym and see some friends, and they're like, "Hey, can you check my knee out?
Yeah.
I had a pop 2 years ago.
Yeah,
I
yeah.
think I know ACL."
Yeah.
I'm like, "Oh, you haven't had an ACL for 2 years. How does
Yeah.
it feel?"
Yeah.
And sometimes they're lucky
Yeah.
and they're okay, but you still have to do the PT.
Correct. Yep.
So even if you're going to non-op, you got to go to physical
yeah.
therapy, and that's kind of the trade-off. People don't want to do that.
Yeah, and they do there's a lot of research that's in Australia because it's socialized medicine. Like you might, if you tear your ACL, you might not be getting surgery for like 3 years. So they really push rehab over there. And there's a lot of times that if somebody is not a COPER, if you go through like a full course of rehab, you actually can become a COPER. And then jiu-jitsu specific, it's also very style based. Like if you're a guard player, like you probably could get away, even if you have a little bit of instability, like you could probably get away with it versus if you're like a speed loose passer, like
Takedowns, wrestling.
yeah, like those type of athletes, maybe you want an ACL.
Yeah. I want to talk about modifications when
Sure.
you're training. So people have injuries.
Sure.
We don't want to be out.
Yep.
Right? We don't want to be out. I think you quoted a paper yesterday that if they're out more than a week, the mental satisfaction goes down.
Correct,
And
yeah.
you become sad, right?
Yeah, yeah.
And so after a week of not training in
Yeah.
martial arts. So I think, for example, I have a neck injury right now.
Sure.
And so yesterday I was rolling with your wife, who was
Yeah.
an amazing. I had such a good time rolling with her because it's very difficult to find 120-pound female
Yes.
high level
Yeah, yeah,
that
yeah.
are technical and safe.
Yeah.
Like I felt safe doing my whole game with her.
Yeah.
But at one point, she was very savvy with leg
Sure.
locks and defending.
Yeah.
And I had to invert to continue getting the leg lock, but I bailed because I was like,
yeah.
that's not worth my neck.
Yeah,
and
yeah.
it looked probably ridiculous because I just
Yeah.
like flapped my legs
Sure, sure,
out
sure,
and
sure.
I bailed to a turtle.
Yeah.
That's hard to do.
Yeah.
And I really had to think about it. And when you're not with safe partners, you might not think that because you're so
Correct.
busy protecting yourself that
Yeah.
you're not thinking that way. How do you recommend people train while protecting injuries?
Big thing, if you can control your training partners, we all know those people that you say go light and then they roll like it's 80cc finals. So avoid those people. If you can stick with people your size, I mean, not everybody has this option. Like, I mean, like with women, there's just not a lot of people your size, you know. But finding the smaller people. Usually, I would say a higher belt knows how to flow, right? Let them know, and then if you can, like one of the things which is hard for me to give like global advice, but you take something like a neck injury, and if you kind of see how these neck injuries occurs, so anytime someone's gonna grab my neck, so it's takedowns or I'm doing a lot of like smash passing, half guard, these are things where all you can do if you're the opponent is grab the neck or the arm, right? So if you do something like loose passing, standing passing, like the neck is nowhere nearby, So that would be obviously something you can do. A lot of guards, assuming you have the awareness to not invert, as obviously can be safe. And sometimes some people don't necessarily want to modify, but for the most part, if I can get them back to doing something, you're like, I can have you do this. It's not inverting, it's not what you do, but it's jiu-jitsu. And then, because I'm also an instructor, so I always push my students. I'm like, you don't always have to play your A game. Like, you should be developing. You should never be the same grappler that you were 6 months before. So even if it's not your game, like, you just start working on stuff, and then that becomes your thing. Like, that's why I use the example of Gordo, the creator of half guard. Like, he had a knee injury, couldn't play normal guard, so he just played half guard so he could still do jiu-jitsu, and then he revolutionized it, and now we have modern half guard. So it was like something where, the injury pushed his technical, innovation.
And that's every injury I've had.
Yeah.
I've developed a different part of my game.
Yeah.
Before my neck has been bad for years.
Sure.
But before it got bad,
Yeah.
I was a lot inverting and doing these things with big people, not knowing any better, getting stacked, and then it got bad.
Yeah.
And so all of a sudden I was forced to play top game. So
Sure.
every time that my neck acts up, my passing gets phenomenally, substantially better.
Sure.
Because then I just do that. But you have to talk to your partners.
Correct.
Right? Like my fiance is 215 pounds. And I'm like, hey, babe, my neck is hurting, so I'm just going to be passing right now.
Yeah.
And he loves to wrestle, so it's very
Yeah.
hard for him. So he has to work on his bottom game
Yeah.
too. Right? So that's a great tactic, I
Yeah.
think. Let's talk about rest.
Sure.
Even without injuries,
Sure.
we all overdo it.
Sure,
right?
sure,
We're
sure.
trying to do twice a day.
Yeah.
We're trying to train every day. How do you talk to your athletes about rest? What do recovery days look like? What do deload weeks look like? And how do you recommend that?
So in a perfect world, what we would do is because for the most part, you should kind of know what your training schedule looks like between jiu-jitsu, strength and conditioning, and then like life stress, because these are all things that play in. Like you being an orthopedic surgeon, like you have a lot more stress than I do. Like, at least I feel like when I go in the OR, like I get stressed just observing, but like that affects your, how your recovery. So, what you can do is load management is super key. Like you can't just be like, I'm going to train hard every day, every session, twice a day. That just your body won't be able to handle that. And it's a gradual accumulation. So people see these high level grapplers that could be on performance enhancers, so it allows them to train more. But if they're not, like they didn't just do that in one day, they built their way up. So it should be great exposure to adding new stressors. One of the things that I'll do is I might have, like, if I do 2 training sessions in a day, or I do like a skill training and a physical capacity training, I kind of say, hey, this is a skill day, but I'm also going to do like a heavy leg day. Maybe I'm doing like a moderate intensity training. So one of the ways that I can do, like I like doing a lot of takedowns, or at least because it's something that I want to be better at takedowns. So if I know that I'm going to be tired from strength and conditioning, like I might just be like, all right, I'm going to pull guard today, But then if I'm not doing a double, be like, okay, now I'm going to do takedowns, And I've done that where I would do 2 jiu-jitsu sessions a day, and I'm getting older, so those I don't recover as well.
Yeah.
So I can't do 2 hard days. It might be like a hard session, and then the next session's a little bit lighter. Where, maybe, and I'll have like light sessions, like when I roll with my wife, like I just put myself in like really deep submissions and try to work my way out, because like she's not going to hurt me and it's something I have to do anyway, so it's a way that I can still get something out of it even if I'm going light. And then when it comes to like ways you can know when you need to, I like using a lot of objective data, so I'll use resting heart rate. I got a Fitbit, which kind of tells me, so I can kind of see how my body is recovering. I'll also use heart rate variability, so I'll use the Morpheus, which is, in the morning, I check it and kind of gives me a recovery and a HRV. So it kind of lets me know how I feel.
Is that a chest strap, or is that something you stand on, or?
So there's 2 versions. So I have one of the older ones, I think, to get rid of it. So it's like a forearm strap that I use in the morning, and then I use the chest strap when if I'm actually going to do cardio training. I think they've switched and they've gotten rid of the forearm, but like because I have that, I can still use it. And sometimes the data will give me different if I use a chest strap for the morning. And
I heard the chest strap is a little more accurate.
It is,
from some of the podcasts I've been listening to.
So like when I do conditioning programming for my athletes, they have to have a chest strap monitor.
Okay.
I won't let them, like I worked once with a guy who had like an Apple Watch, and the data was so horrible, it was useless. I wasn't, like I might not have even done any objective data because it wasn't helpful.
And when your HRV is off, like probably too high?
So it goes both ways. So if it's too high, then you're more likely in a parasympathetic nervous state. So maybe you're recovering from something. Maybe you're getting sick. So high isn't always good. And then if you're low, that usually means you're more sympathetic, like you're overtaxing yourself. And I've listened to some coaches where they feel like it's just noise. It doesn't tell you anything. I mean, I can see, because like let's say like my recovery day is poor and it says you're in the red zone. Like I can still train if I want, but then what I notice is then like the next 2 or 3 days I'm still in the red. So it's kind of like I can train hard because like let's say like this weekend, like I was expecting to do a lot of training, so it's like I'm gonna roll even if my recovery is bad because I wanted to train with a lot of the people here. Thankfully, it wasn't bad, but so you don't always get to control the situation. But then there's that repercussion of now I feel like I'm kind of digging myself a hole, and now I have to take a few days off to kind of bounce back. So for me, subjectively and objectively, I think they're fairly close. For some people, they just go by how they feel, which is
Fair.
fine.
Yeah. As long as you're listening.
Yeah, exactly. Yeah. I have multiple clients / old training partners that stopped using the Morpheus because they're like classic overtrainers. Yeah. They're like, well, it tells me not to train, and I'm not going to listen to this. They just stop using it.
And I'm guilty of that too.
Yeah.
I'm guilty of that too.
Yeah.
I think as we get older too, I mean, 30s is not old, but for jiu-jitsu, we were talking, that is kind of a little bit on the older side.
Yeah.
things change.
Yes,
right.
they
I don't
do.
go as hard in the paint as I used to.
Yeah.
And I look for partners that are safer.
Sure.
Okay, let's go on to some injuries, specific injuries.
Sure.
You post a lot on Instagram about different positions and knowing when you're in a dangerous position.
Sure.
I think that was part of what happened with my ACL.
Yeah.
I didn't realize how much danger I was in.
Yeah.
Especially in competition, your brain kind of just goes blank.
Sure,
and you're
sure,
like,
sure.
I'm here to win.
Yeah.
And so what are the most, or some injuries that you've seen occur where somebody might not know that they're in a dangerous position?
I would say just a lot of leg entanglements. I would say, thinking about one of the big ones, lockdown's a big one. You hear a lot of people getting injured with lockdown. And it could be a variety of things where if you don't train with anyone who's done the 10th planet style, like they don't even know what this is.
Or don't think it's that dangerous.
Yeah.
I've seen a lot of ACLs pop.
Yeah. And I see a lot of injuries that happen from leg entanglements are people that just like disregard the entanglement and they just try to bust through. There's a good example of TJ Dillashaw when he fought Corey Sandhagen. So Corey Sandhagen gets him in an inside heel hook, and like TJ Dillashaw just completely ignored the leg lock. He just kind of like shrugged his leg, popped his knee, and got out. But he ended up tearing his meniscus and his LCL. Like he ended up winning the fight, but he was out for a year. And then, I think he had one other fight, which might have been, I think he had maybe one comeback fight after that, maybe two, but like that was when his shoulder was so unstable. So it's kind of like, he lost a year of his career just because he blatantly just ignored the leg lock. A good example, if we look at UFC fights, there was also Corey Sandhagen versus Figueiredo, where Corey Sandhagen had him at a 50-50, and he went for the sweep. And we just talked about 50-50. A lot of people, they think, the point of 50-50 is to get to a leg entanglement, but if you resist, and I've worked with a training partner where I swept him from 50-50 and he was fighting it and he popped his LCL. Thankfully, it was only grade 2 and he didn't need surgery, but, it's one of those things. I think that's a big one that people don't realize that, if you ignore, like if you fight it and your knee is in a somewhat of provocative position, it can be damaged.
Yeah, I think that happened to me last year, a 50-50 position where the clock was running out, trusted training partner, but I didn't have my leg reinforced and my foot was on the hip.
Yeah.
But you're almost locking your own knee in place, right? If you take your toes around the hip line.
Sure.
And then my partner kind of tried to blast through my knee, and I felt a stretch, thankfully, and everything was just a sprain. Everything was clean. It was just a sprain to the ACL, but I was very grateful because I didn't want to do an ACL again. But it took me out of Worlds last year, out of Pans, or out of Worlds No Gi, and I learned a lot. It's like, hey, I need to be better about protecting myself and maybe reinforcing that leg, or realizing another friend, she had her ankle popped because of a De La Hiva. I think she had a very tight De La Hiva hook, and then the opponent tried to blast through or tried to like rip the De La Hiva aggressively, and her whole ankle popped. She's recovering from surgery now from that.
Wow.
Reverse De La Hiva too. Anything where you have a hook in like that, and if people just blast through. I think just being more cognizant of not doing these blasting or super spinny motions, anything really quick like that when your knee's compromised. But it's hard to do because your instinct takes over. Okay, maintenance physical therapy. People laugh at me because I have standing appointments with physical therapists and just to take care of various injuries that I've had for a long time. Is there something that you recommend people do every day, every other day? Should everybody be doing some kind of maintenance?
So my maintenance, and I know, I didn't get to show it tomorrow, but there's videos, but I use something called a CAR, controlled articular rotation, which essentially is an end range rotational movement, and I can do it through every joint on my body. And the reason why I do that is because, one, you don't lose range of motion because of age. It can get worse, but I think it's more from disuse and injury, and the injury could cause the disuse. So I kind of think CARs have a few different roles. So one, I can use them as a joint maintenance. It's kind of like joint flossing. It's like with flossing your teeth, you're just kind of getting rid of all the, bad stuff. Same sort of thing. Like, people go to jiu-jitsu, like even if someone's torquing on your Kimura, like your shoulder with a Kimura, not bad enough where you're damaged, but you're just putting that little bit of stress. There might be just this micro trauma that overall, if someone does that day in, day out for years and years, now you notice your shoulder is getting more limited. So I like doing controlled articular rotations. I think they're very beneficial. I also think they're a good, very self-assessment because as you're going through something, if you start feeling like, when I'm taking my shoulder in this range, I feel pain.
And compare it to the other side.
Other side,
okay, that's tight in that. What would be an example of like a CAR for a shoulder?
Shoulder. Okay, so normally I would have more room. So what I'm going to do is I'm going to start with this externally rotation. I'm going to go across midline. I'm going to go as high as I can to this max elevation. I'm going to keep my chest nice and tall. I'm going to start to externally rotate my shoulder, or internally rotate. And I'd go all the way back. I shouldn't be moving my shoulder, but this, or my chest. This is just so I don't hit this thing. I'm going to go all the way around, and then I reverse. So essentially what I'm doing is I'm doing a rotational, so not only am I doing a big rotational movement, but I'm kind of taking that glenohumeral joint and I'm spinning in the socket as I go. Okay. So typically what you're going to see when you run through someone, if someone has like a closing angle pain, or classically for people who aren't in the medical field, like that's like an impingement, right? Yep. So what should happen in a healthy shoulder is you should have more of a stretch in the lat. But if I'm getting a pinch in the front, what that's telling me is that shoulder, there's aberrant joint movement. Like, it could just be like it's sore, but it might be that there's like something going on. And especially if there's I get a very sharp focal pain when I'm going into internal rotation, that gives you information. And then usually what I can do is then I can get them on the table and I can check their rotation and be like, oh, now your internal rotation's really poor. Maybe this is something I need to address.
And do you do these for yourself every day? Mm-hmm. You try to make sure certain joints are where you're kind of sore.
Sure. I do. So what I do is I do them daily. I probably realistically do them 5 days a week because, everything. But I do them daily, and what I'll do is also do them before I do a workout. So if I'm doing jiu-jitsu or I'm doing a strength and conditioning program, if I do strength and conditioning, it might be like related to what I'm doing that day. So if I'm doing like a upper body day, I might be doing elbow, wrist, shoulder, whatever.
I do cars for my hip every time I run.
Oh,
before I run.
Yeah.
Because tight hip flexors and tight IT band.
Yeah.
And I think that's helped tremendously with running.
Yeah. So that's one. If I'm doing jiu-jitsu, like if anything's sore or it's like, okay, well, what I like to do, so like, this week we're doing leg entanglement. So I'd be like, all right, well, I'm going to do hip because I'm going to do a lot of leg dexterity. I'm going to do knee because of that rotational movements, and then I do some ankle stuff.
Your knee car, would that just be like internal, external rotation of the tibia or the shin bone?
So what I do is like you can start from 90 degrees. I could just rotate back and forth, and that's the rotational component. And then what I can do is I can add a linear component where I externally or internally rotate. I straighten as much as I can, and then I internally rotate from there. So essentially it becomes a rotational movement. Mm-hmm. Usually when I teach people, because if I said to the average person, I want you to rotate your leg, you're going to look at me like I'm a psycho. Yeah. So usually what I'll do is I'll just start with just in place. This would be called a capsular control articular rotation because I'm just working on that rotation. Then initially in the initial phase, I usually will do the transition at that 90 degrees because it's easiest. So I'll have them bend and straighten, rotate, bend and straighten. And then as they get better, then I can have it like being very circular.
And I think most people don't understand how much motion there is to the knee.
Correct.
Right? We just think it's kind of bending and straightening. But there's so many extra varus valgus, right, in and out, and then there's that rotation that people don't appreciate.
Yeah.
And that's a lot of how ACL tears happen.
Exactly.
Is that rotation.
Yeah. So like one of the big things, and as an instructor, like I have run some of my students through cars, but then there's always the big thing before class. It's like, how much time do I want to devote to this? Because it's like, the more that I do, it's like learning a jiu-jitsu technique. So it's like, and I'm big on like training time should be for training. So like if I have 90 minutes, my warm-ups are those games. So it's like I'm not having people run in place. Like we're just doing low-level grappling activities. So everything should benefit. But it'll be very fascinating is, because a lot of my students are also current or former patients. You can see people doing their exercises while they're waiting, which is hilarious.
That's good.
Yeah.
Okay, so for warm-ups, right? Everybody is so warm-up averse. And I'll tell you, I even trended towards warm-up aversion myself when I teach.
Sure.
Because I was like, we only have an hour.
Yeah.
Right, so you really only have 40 minutes of instruction, for example, and then maybe 30 minutes, and then the other for training, because people want to roll. And and a lot of people, it's their workout, right? People come in after work, and they don't want to hear you talk for an hour.
Sure.
What warm-up would you recommend for like 5 minutes that might be helpful for a class that's only an hour, just to get everybody's joints moving a little bit better and ready for the class?
What I would do in a perfect world, if I can teach my people to do it before class because everyone's waiting, so I'd have them do, where do we know that you're going to get hurt? It's going to be shoulder, knee, and your spine. Maybe neck, elbow, elbow. So I might have them do a few of those before. And then my warm-up, like I said, is low-intensity grappling. So like a lot of times I'll warm people up. We're starting with pummeling because that's an important skill. Mm-hmm. I might be doing hand fighting because you're competitively moving. It's really important. Yesterday, I did So just like these like CLA games, I just pick specific low intensity ones. So like a guard retention game where it's like, I'm just trying to get inside control, or I'm trying to touch you with my feet. Passer's just trying to clear the feet line. So it's a way that they're getting to do jiu-jitsu, but it's low intensity. So, and then one of the things that I don't know if you're supposed to do in CLA traditionally, but I will still do, is I explain why. Because I think a lot of times, a lot of the motor learner people will say that if you explain to them that you might be somewhat controlling their ability to learn because you're molding it. But I've also been in stuff where like we've done these games and I didn't understand the point, where so it didn't actually click. But if I'm like this, and I tell everyone very, very simple, like this silly game when I'm passing, I'm thinking, I do that with every single person when I pass. It's like check in the box, clear the feet net, clear the feet line, clear the knee line, clear the frame, I'm passed. So like, I might even be like, or I might like roll with like a white or blue belt and I'm doing it with them. And then I said like, that game that we did in the beginning, I just did that for 30 seconds and you didn't know, So then they realize like, oh, here's a black belt and he's doing it, So what I would like to think is that what gets buy-in, where the student's like, oh, this actually does make sense. And then because now they're warming up, they're getting warm, now they're ready for that harder training. Because the big problem with warm-ups is people will do, and we've all been in those classes. I don't want to say that they're necessarily run by Brazilians, but they're like 30, 45 minutes of like conditioning and you're exhausted, which the problem with that is if you do that now, it's going to affect your motor learning, so you're not going to be as good at processing, right? And then it's like, why did I spend 40 minutes doing conditioning when I could have done that on my own? And this coach probably isn't a strength and conditioning coach. So it's like, what are we doing here? You know what I mean?
Yeah. Sometimes for comp classes, I
Sure.
love that.
Sure.
And it has its role, but
Yeah.
probably not every class.
Yeah.
For comp class, you do all that and you're
Yeah.
exhausted. You
Yeah.
have to know how to also
Correct.
compete when you're exhausted.
Yeah.
But it doesn't have to be every class.
Yeah.
You have to
Yeah.
get your foundation first.
Sure.
Okay. Moving on to some other coaching things. What, if you could change one thing about like how gyms manage injury prevention, or not even change it, but what could you recommend to gym owners that might be seeing a lot of injuries? Because they happen in jiu-jitsu frequently. And so how could you recommend people?
So I think a lot of injuries is based on the culture. So I really, really push in the gym a culture of learning versus winning. Like I'll tap to colored belts. I don't care. I tell people, I'm like, see this blue or purple belt? I tap to them.
Yep.
So if I'm a black belt and I tap to a color belt and you're a blue belt and you tap to a blue belt, why do you care? Like, why are you upset? So I kind of focus on that, and it's like, because look, if you're always just playing your A game and be like, cool, I'm the best in, like right now we're in the middle of nowhere, Eastern Washington. Like, so it's like, I'm the best guy in this little town. Who cares? Nobody cares, right? So, you'll never be able to actually add technical skill, because anytime you add a new skill, you're not as good. So if you're like, well, if I go to this, I'm like, I want to do this, but then they might tap me and I'm scared, so I'm just not going to do it. You just never progress. And we've seen all those people, and this is something that I got plateaued at purple belt because I would just try to win every roll, and then I was a purple belt for 5 years. I'm like, why am I not getting better? Probably because I had the wrong mentality, right?
Using the same couple moves that you're good at.
Yeah.
Which when you're going for competition, sure.
Yeah.
Sharpen that stuff, but in the regular days, I'm always trying to learn new things and teach new things to my students.
Yeah. And so one of the things I tell people, you don't have a competition on the books, you should be focused on motor development. You have a competition on the book, then you switch from motor development to competition prep. So that's when you can start to refine, So I think that's a big one. And like I said, because I focus on that, I think students get there. Focus on control. Like, we were doing leg locks, we were very controlled. It was never like, I'm trying to destroy your leg. And like, I've been with people and I'll catch their leg and I just hold and I kind of see. And I'm not a big fan of catch and release, because if I catch and I release, that doesn't, so now then you don't have the awareness, like you were caught. But then also, like, I do think understanding braking mechanics is important. So what I mean is once I have the control, I can apply it slow. So I'm giving someone plenty of time to tap. And if you watch some of those videos that I showed yesterday, how many times did something happen where they could have tapped but they didn't? They had plenty of time to tap. So I think as long as you give somebody time to tap, like I said, I've never hurt anyone with a leg lock since I've been here, and I heel hook white belts and kids, and I don't care. But
Yeah, I teach all levels because I think it's important just to understand how to apply them, how to defend them.
Sure.
And so I teach that in my class.
Yeah.
But I do teach more of a catch and release because I'm more nervous that the other person's going to roll the wrong way.
Oh, sure.
And inside versus outside heel hooks.
Yeah.
Inside heel hooks I think are more dangerous, more catastrophic.
Yep.
You can get a much tighter bite on it, and the rotation isn't as easy to get out of.
Correct.
But just the mechanics of it, the way that your leg is rotating to the outside, you can do more damage to the knee.
Absolutely.
And if somebody rolls the wrong way,
they're gonna hurt their
they're gonna destroy their knee. So I do have my people catch and roll. I'm like, if they're not gonna tap, you move along.
Well, what I mean is, I will release. I will catch and release. But what I mean is, I don't just catch it and then let go, and then they don't realize. Because there's some people that they catch it and then let go.
I probably do that too much, where I catch it because I'm so nervous since I've been in it.
Sure.
But no, that's a good point. And just understanding, look, this is a checkmate.
Yep. Another thing I would say is teaching break falls, like watching people break fall yesterday. I would say that I was like kind of, obviously there's a lot of different skill levels. I know so many jiu-jitsu gyms that just kind of breeze through break falls. I think that's just a super easy skill that everyone should know. I really think everyone, even if they don't do grappling, should know. Like, you should learn how to fall. Like, I was running once and I tripped and I just did a roll without thinking about it. I'm like, oh, that was kind of cool. But I didn't think about it. I just did it.
Especially aging populations, and here where it snows and the ice, we see so many older people breaking hips and wrists and backs and things because they just fall on ice.
Yeah, there was a super interesting study. I think it was somewhere in Britain. It was the British Journal of Sports Medicine that released it, but it was like doing a community practice of break falls. It was specifically like a judo practitioner was teaching older people how to fall, and it was like, and when I was in PT school, I did a clinical in service, and this is 12 years ago at this point now. But like, I remember like, this would be a cool idea. So then, and I just talked, it was a skilled nursing facility because you have to do your rotations, right? And I'm like, this would be a cool idea. And then seeing how like someone actually did a paper to show, and I've shown a 7-year-old woman how to break fall. Again, I'm not Haraya Goshing her into a mat, but I'm like, there's the ways you can regress it. And I think those are super important because if you fall correctly, you can minimize injury. Now you're not scared of takedowns. And so many people are like, I don't want to do takedowns because I don't want to get injured. But it's like, now you're a novice if you do them.
Right. Yeah, learning how to fall is huge. We definitely don't focus enough on that. And I think that's something I took away from yesterday. Yeah. Go try and teach some better break falls because my break falls aren't great.
Yeah.
Like, I've fallen on my head more times than I can count, just not doing it appropriately or not wanting to concede.
Yeah.
And I think that's super important.
Yeah.
Okay, so kind of finishing up here a little bit.
Sure.
If you could give one piece of advice to white, blue belts, maybe even younger, because I probably could have used this advice when I was in my 20s starting out, what would you recommend for longevity in the sport?
Just tapping and training doesn't mean you're losing. Who cares? It doesn't, I think like I tapped a lot at black belt. I just stopped caring. I think you just get to avoid a lot of unnecessary injuries. Just have more of a skill development mindset than a winning mindset. Competition's different. Obviously, you're at a world championship. I've been there. I've got my joints popped in a competition. Whether it's good or bad, it happened, and I get that. But like in training, like, who cares? Like, you losing in training doesn't mean you're bad at jiu-jitsu. It's just you got caught, right? So I think those are two super easy ways where you can minimize unnecessary injuries, and then you take that mindset, you'll probably get better jiu-jitsu quicker, in addition to having less injuries, which we know is probably the biggest limitation for mat time.
Cool. All right, well, thanks for being here. I know we said we were going to keep it short, but we ended up talking a little bit.
Yeah.
And where can people find you?
So find me on Instagram. It is the word Dr._Kickass. That's probably the easiest way. And then, Facebook, YouTube is there. And, I have links to all my rehab courses on my Instagram.
Yeah, really great stuff for physical therapists, athletic trainers. Even myself, I enjoy it to help with recovery from surgeries and making sure that people are doing the right things and not going back too soon.
Yeah.
All right, well, thanks, Mike.
Yeah, thanks for having me.